Hello ladies and gentlemen, this is Dr. Ahmad. Today we are going to review some of the common positioning errors in obtaining panoramic radiographs. Panoramic radiographs are one of the most difficult images to make. Also, panoramic radiographs are quite difficult to read because of the anatomy and also because of many errors. If we can eliminate these common errors, reading panoramic radiographs will be easier. Here is a study done in Michigan and published in 1987. The authors had collected 500 panoramic radiographs from private dental offices. This paper tells that only one of the 500 panoramic radiographs had no technical errors. Of the other 499 panoramic radiographs, 55%, which is more than half, had 5 or even more errors. About 10 years later, and this is 1999, a study was published in British Dental Journal. This paper also lists a number of errors. Some of these errors are related to film-based radiography, like absence of markers and poor film and screen contact. So these are not applicable to digital panoramic radiographs anymore. But the most common error listed is the position of the tongue in relationship with the heart palate. This study shows about 71% panoramic radiographs had tongue positioning errors. So this is 7 out of 10. So if a dental office has taken panoramic radiographs on 10 patients, there is a good chance that 7 of these 10 patients ended up with faulty radiographs. That's not a very good news. The same paper also tells about 58% or almost 6 out of 10 panoramic radiographs have anterior-posterior position errors. Now these are adding up. A patient may have both tongue position error and also anterior-posterior position error. Fast forward to 2012. So this paper was done in Israel. So let's see what they found. In their review, one study showed that 33% of the radiographs were totally unacceptable for diagnosis. And only 0.8%, that's less than 1, were suitable for accurate diagnosis, and 66% were accepted. This means 1 out of 3, 33%, which are unaccepted. That means 1 out of 3 panoramic radiographs are so bad that the image should not be used for diagnosis. Another study had shown that 96% of the panoramic radiographs had errors. This means only 4% of the panoramic radiographs are without any errors in that study. So what did they find in the study done in Israel? In their study, 40% of the radiographs were non-diagnostic. That's 4 out of 10. This study is from Sweden and again published in 2012. And they show that 96% of their cases had errors and about 80%, 79 or 80% of the cases had tongue position error. That's 8 out of 10. One more paper, and this study was done in India. This paper reports that 25%, 24.9, that's almost 25%, which is 1 out of 4 panoramic radiographs were unacceptable. Think about this. If you go to a burger place and every 4th burger that you buy is rotten, are you going to go back to the same place? You got the point. Earlier we had seen another study that showed 1 out of 3 panoramic radiographs were unacceptable. So 1 burger out of 3. These numbers vary from one study to another, but the fact is that a large number of panoramic radiographs are not good for diagnosis. And it's not Michigan, or England, or Israel, or Sweden, or India. It's everywhere. No doubt, panoramic is a difficult radiograph to take. So with this, we must learn the most common panoramic errors and try to eliminate these. So first we'll talk about the ideal panoramic position. In this section, we'll learn what are the features that make an ideal radiograph. I'll show you an example which may not be excellent, but is diagnostic. Next, we'll learn how tongue position error appears. As we have just learned, tongue position error is very common. With good instruction, tongue position error can be reduced, if not completely eliminated from your practice. In section 3, we'll learn about the anterior-posterior error. This is also a common error. We just reviewed that some studies have shown 6 out of 10 panoramic may show such an error. Then we'll talk about lateral or head rotation errors. The patient's head is rotated towards the right or towards the left. In section 5, we'll talk about superior-inferior position error. This means that the chin is either tilted upwards or chin is down. This is also a very common positioning error. If the patient moves a lot, the motion errors are easy to identify. Subtle motion errors can be difficult. So we'll review a few images that shows mild or significant motion artifacts. In section 7, we will review the concept of ghost image and real image. Finally, we'll review some common foreign bodies that may be recorded on a panoramic radiograph. Let's meet John. John has arrived at the dental office. He is due for a panoramic radiograph. Before we can position John in the panoramic unit, we have to do a few clinical examinations. Let's see if John has anything metallic that can be removed. This includes hearing aids, headphones, earrings, dentures, eyeglasses, necklaces, or non-metallic objects such as candy or a chewing gum. If he has a mask with a metal nose clip pulled down on his neck, let's remove that mask too. Okay, we see that John has eyeglasses. Time to remove that. Now looks good. John is now ready for positioning in the machine. Let's ask John to grab the handle of the panoramic unit with his both hands. If the machine has a head positioning guide, his forehead should touch that. If there is a chin rest, his chin should be on it. Let's ask John to bring his feet a few inches forward. His back leans back a little bit backwards. In this position, if he releases his hands, he might fall back. John's back is upright and he is not slouching. This gray rectangle will be the location of the sensor or the X-ray film. And John's face is in the right position for radiography. The panoramic machine have a bite block with a groove in it. John has to put his anterior teeth of both arches in that bite groove or the notch. Keeping the anterior teeth in the groove makes sure that both arches are in the focal trough. The plastic bite block also separates the upper and lower teeth. So we are looking at the shape of the mandible. A focal trough is an imaginary three-dimensional area. Any object inside this focal trough will be properly imaged. The gray shaded area is the imaginary focal trough. We can see that the focal trough is wider in the ramus area, giving us a little bit more freedom with different jaw sizes. On the anterior, the focal trough is narrow. So it is very important that we ensure that the anterior teeth are always in the focal trough. The yellow shaded band is the path of the X-ray sensor as it moves around the jaw. So some panoramic units have laser beams to help us orient. These lines may go through the midline of the jaw or by the canines on both sides. Use these laser beams to your advantage in positioning the patient. We'll take this panoramic radiograph as an example of good exposure. Not perfect, but very good. Let's look at a few features. First, look at the orientation of the teeth. These teeth are separated by a few millimeters because of the bite block. The anterior teeth of both arches reflect normal size, not too large and not too small. The occlusal plane has a slight smile. The posterior border of the ramus has a slight distal tipping. And the hard palate is almost flat. The hyoid is not superimposed over the body of the mandible. The vertebra, which we barely see here on this cropped panoramic radiograph, should not superimposed over the ramus. In Unit 2, we are going to review the tongue position error, the most common error. Our literature review has shown that 70 to 80% of the panoramic radiographs have tongue positioning error. Ideally, we want the dorsum of the tongue touching the hard palate. Sometimes the patient cannot follow our instruction and do not put the tongue on the roof of the mouth. Sometimes during exposure, the patient becomes tired and drops the tongue. Here is an example of a panoramic radiograph with tongue position error. The yellow arrows show the dorsum of the tongue. The tongue should have been touching the hard palate. Now we have a dark band of air shadow. Sometimes this air shadow will superimpose over the roots of the maxillary teeth and make it difficult to read the panoramic radiograph. In this example, during the exposure of the right side of the jaw, the patient did not put the tongue on the roof of the mouth. So we ended up with a very dark area around the midline of the upper jaw. We do not even see the apical regions of the anterior teeth properly. If there is a disease in this area, we cannot identify that. On the left premolar molar region, the tongue is in a better place and then it drops down again. So the patient tried to put the tongue in the right place during this part of the exposure. In this example, the patient kept on moving the tongue at the last moment of the exposure. Because of the repeated movement, the dark area has irregular borders. Anterior-posterior position error happens when the patient is not biting in the groove or the notch of the bite block. So in the ideal position, the incisors should be on the bite block, both upper and lower incisors. In the wrong position, the groove or the notch may be too far inside the mouth or too far outside. So in this cartoon, the patient has moved too far anterior. This means that the patient has swallowed the bite block by a little bit. We see that the groove is, or the notch is not in contact with the incisors. So this would be the ideal location of the anterior teeth in the focal trough. If the patient has moved too far forward, the anterior teeth will be very close to the X-ray sensor. When the teeth are close to the sensor, the images of the anterior teeth will be smaller than normal. So this is an image of a phantom, a skull. The skull is covered in plastic, so it was not possible to put a bite block. Without the bite block, the posterior teeth are in occlusion. We have just moved this phantom too far anterior in the panoramic machine. Now we see that the anterior teeth are narrow. See the size of the mandibular incisors? These may look like matchsticks. Here is an actual patient. The patient is too far anterior in the machine. So the mandibular anterior teeth are very narrow. There are several other errors in this panoramic radiograph. We have already learned about tongue position error, and we can see the dark area over the maxillary teeth. This patient was slouching in the machine. So we have vertebrae on both sides superimposed over the ramus, mostly on the right side. There are other errors on this radiograph, such as the chin is too far down. So let's review the chin down position in a few minutes. So in this cartoon, this patient is too far posterior. It means that the patient is holding the bite block with their lips, not with the incisors. So again, this is the ideal location. The anterior teeth are in the gray shaded focal trough. If the patient is too far posterior, this is the sensor shown by the yellow line. When the teeth are too far away from the sensor, the images of these teeth will be wider or larger. They will be magnified. Again, this is our phantom in a plastic. Same phantom. Let's look at the anterior teeth of both arches. These are wide. We remember that the skull was too far anterior. The anterior teeth look like matchsticks, the same teeth. This is an example of a real patient. The anterior teeth of both arches are very wide. In the lateral position error, we'll review if the patient has his head rotated towards the right or towards the left side. So again, this is the ideal location of the anterior teeth of the focal trough. The position of the teeth of the posterior teeth are centrally in the focal trough. So we'll call this right side and that's the left side. If the patient's head is rotated, the right teeth are closer to the sensor. So we are looking at the patient at the jaw as if the back of the head is on the bottom of the screen, the nose is pointing towards the top, and we are standing at the foot of the patient looking towards the head. So this side is the right and this side is the left. So now that the right side is closer to the sensor, the right teeth will be narrower. The left teeth, being further away from the sensor, will be magnified. The opposite may also happen. This time the left teeth are closer to the sensor, so the left teeth would be smaller, and the right teeth further away from the sensor would be wider. It's not only the teeth, the ramus of the left side is also closer to the sensor, so the left ramus would be smaller or narrower. The ramus on the right side, being further away, will be magnified and will be wide. So on this radiograph, we can see that the right ramus is much wider than the left. So the patient is rotated. So look at the first molar on the right side versus the width of the first molar on the left side. So the patient is rotated and the right jaw was away from the sensor, so that's why the right jaw is magnified. Remember that further away from the sensor, the structures are magnified. the opposite error in this patient. This time, the left posterior teeth are wider. These teeth are wider. They are away from the sensor compared to this. So this is closer and this is away. So it's more magnified. Again, the left ramus is wider than the right ramus. So that's lateral error. Patient's head is rotated to either right side or the left side. It may also happen that the patient's jaw is actually large on one side. In such condition, the image will be wide on one side. So in this example, we see that the left ramus is very tall, taller than the right side. Also, the left body of the patient is taller. So in such cases, there may be lateral errors, which even if you try your best, you may not be able to eliminate. Let's review the superior and inferior position error. So the patient may be biting on the bite groove, or the chin is pointing up. So again, this is our phantom with the chin pointing up. There are a few features of this error that we can easily identify. First, instead of the slight smile, we see the occlusal plane is pointing upwards. Also, we see that the hard palate is pointing upwards at the center of the film. Looking at the posterior border of the ramus, these are tilted back. Sometimes the condyles would be missing. So this is an example of a real patient. Even with many missing teeth, we can see that the occlusal plane is pointing upwards. The hard palate is also pointing upwards around the center of the film. This time, we could not even record the condyles. The condyles were projected outside the film. And you can appreciate a little bit that the posterior border of the ramus is tilted distally on both sides. This is an example of less severe chin up. We can still see that the patient is not smiling, so the occlusal plane is pointing slightly upwards. And look at the hard palate, it's pointing upwards around the midline of the film. On both sides, the posterior borders of the ramus have slight distal tilt. You can also see that the patient has not put the tongue on the roof of the mouth, so we have some air shadow here as well as in this area, and that's the air shadow. This is the dorsum of the tongue. So you remember that tongue positioning error is very common and multiple errors can happen on the same radiograph. An error may also happen if the patient's chin is tipped down. The patient is still biting on the bite block with their anterior teeth. So again, this is our phantom without a bite block, but we made the phantom pointing downwards. This time, we have the occlusal plane with a very prominent smile, and we see that the posterior border of the ramus are pointing towards the center of the film. So they are tipped inwards. And we also see that the hard palate is pointing downwards around the center of the film. So in this image, the hard palate is almost straight, but we can see the occlusal plane has a prominent smile. So with the chin being down, the roots of the mandibular anterior teeth are out of focal trough. Therefore, the apical areas of anterior teeth are not properly seen. If we have any disease here, we may have missed that. Again, the posterior border of the ramus, they are pointing towards the center of the film. Here again, we have a patient with a very prominent smile. So that's the chin is down. Again, anterior teeth are not fully recorded. The posterior border of the ramus, they are pointing towards the center of the film. The top of the left condyle is not even recorded, and we can see that the hard palate is pointing downwards. One more case of chin being down. Again, we can see that the occlusal plane has a prominent smile. The heart palate is pointing downwards near the center of the film. The posterior border of the ramus are slightly tipped towards the center of the film. In the left molar region, we can see a disease called periapical cemento-osseous dysplasia. Frequently, this disease happens in the mandibular anterior region. With the chin being down, we do not have good recording of the anterior teeth. So if there is a disease, we are not able to identify that. Sometimes the patient's head may be tilted towards the right or the left. In this example, we can see that the occlusal plane has a slight cant, and the condyles are not at the same level. On the left side, we see that the hyoid has moved, has irregular shape. So this is because of the motion of the hyoids. So let's learn a little bit about motion artifacts. So a panoramic radiograph may take 15 to 20 seconds to complete. There is a good chance that the patient may move during this exposure. The tongue may move, the hyoid bone may move, also the jaw may move. Sometimes the motion is unintentional, such as sneezing or coughing. Please do not talk to the patient during exposure. The patient may want to reply, causing motion. Sometimes the patient wants to look at the motion of the panoramic unit. So it might be a good idea to ask the patient to close their eyes during exposure. Occasionally, for a large patient, the machine may hit the shoulder of the patient, causing some motion. So this is the radiograph that we just reviewed with motion of the hyoid. In this case, the patient moved during exposure of the left molars. The mandibular left molar now appears to have 3 roots. The maxillary first molar also appears to be wide. We see a step defect in the area of the motion of the heart palate. So all these line up at the same location. Look at the inferior border of the mandible, and here is a step defect. So somewhere in this area, the patient moved. So when the exposure is going on, this is the time the patient moved. So the motion is recorded in the same location. In other areas, there is no motion. Also, we see that the hyoid has moved on the left side, not on the right. This patient, who is partially edentulous, had difficulty holding the bite block. During part of the exposure, the bite block fell out of the mouth. As the patient was trying to grab the bite block with his lips, this motion happened. So it is important that we keep and watch on the patient during exposure and stop the exposure in case we see the patient moving. There was no need to complete this exposure. Watching the patient during exposure is legally required. Surely this exposure should not have been completed. The patient sneezed. The operator must pay attention to the patient during exposure. Please stop the exposure in case there is motion. This patient, who has Parkinson's disease, had difficulty remaining still during the exposure. 15 to 20 second exposure is too long for such a patient. In panoramic radiography, the structures inside the focal trough and close to the sensor are real images. There are some structures which are also imaged but are away from the focal trough. To keep the discussion brief, we'll call these images as ghost images. So structures inside the gray shaded area are recorded as real image. These structures are sharp and well defined. The structures on the posterior part of the jaw, mostly in the areas of the blue shaded region, can be recorded on the opposite side. So a ghost of the right side, so this is the right side, the ghost of the right side may be imaged over the left ramus. If we have an earring on the right side, a ghost will appear on the opposite side. So there will be an image of the earring which will be real, and on the opposite side there will be an image, and that will be the ghost. So this patient is wearing 2 earrings, 1 and 2. These are near the posterior border of the ramus, almost at the level of the mandibular molars. And these are fairly sharp. And for the maxilla, we have some fuzzy radiopacities. These are ghost images. These are not real. The right earring, this one, created a ghost image over the left maxilla. And this earring on the left side created a ghost image over the right maxilla. Not only the earrings, but the mandible also creates ghost image. So this is the left ramus, this is the real image of the left ramus, and it created a ghost image on the right side here. So let's learn some of the features of ghost images. The ghost will have the similar shape as the original structure. If the earring is circular, the ghost will also be circular or maybe oval. If the object is a square, the ghost may be a square or maybe a rectangle. So a circular object will not become a square or a rectangle, or a square will not become a circular structure. So in this case, the overall shape of the earring, the general shape, is maintained in the ghost image. The ghost always appears on the opposite side. So this is the real structure on the right side. The ghost is on the left side. The ghost is always located higher than the real structure. So our real earring was almost at the level of the mandibular molars, but the ghost is on the superior aspect of the maxillary molars. Even the real images on a panoramic radiograph are not the sharpest. Panoramic images by nature are not as sharp as images on periapical radiographs. That's the reason that we try to make diagnosis of caries from periapical or bituned radiographs and not so much from a panoramic radiograph. So this real image of the earring is not the sharpest, but the ghost image is blurry or fuzzy. Also look at the ghost image of this mandible, the original side, the real side of the mandible. The image is sharp and the ghost is blurry or fuzzy on the opposite side. In this earring, the vertical part, this red line, may be the vertical part of the earring. If the real structure has a vertical component, the image of the ghost, the vertical component, will be more blurry and more magnified. So the horizontal part is sharper, vertical part is fuzzy and more magnified. So again we have our phantom. We taped a metal marker shaped like an alphabet L, letter L, on the right side of the phantom. So this has a horizontal component and a vertical component, and this is the ghost. So the ghost of the L is on the opposite side and higher up. The horizontal arm of the ghost of the L is slightly magnified and somewhat sharp. The vertical arm is very fuzzy and very magnified. So you also placed a keyring on the other side. So this is a circular keyring and it created a ghost on the opposite side. So this was circle and it created an oval ghost image on the right side Again, the vertical component is highly magnified and the horizontal component, which represents this area, is fairly sharp. So we tried to put both L and O together. Radiology joke. Foreign bodies are easy to identify. Many times, foreign bodies will create ghost images. So let's not discuss ghost image now, but we'll try to identify some of the foreign bodies. If possible, we'll try to remove the foreign bodies before the exposure. The tongue piercing may not be easy to remove during panoramic radiography. This piercing is in the tongue and further away from the sensor. This is magnified, so it appears much larger than what is in the patient's mouth. With the piercing, several teeth in the anterior region are not properly recorded. Also, at the same time, see the tongue position error. The superior part of the maxilla is very dark and we cannot see the apices of all these teeth. So if there is a disease here, we have missed it completely. So this will be a non-diagnostic radiograph for maxillary anterior teeth. The metal necklace has created an image over the mandibular anterior teeth, making this a non-diagnostic radiograph for the mandibular anterior area. This metal necklace should have been removed. At the same time, see the tongue position error again with the dark band at the apical area of the maxilla. So do you remember from our literature review that tongue position error happens in 70 to 80% of the cases? And a proper instruction to the patient to swallow and hold will help in eliminating the tongue position error. So this patient is wearing a denture, so that's very easy to identify. But look at the size of the right molar versus the left molar, so definitely the patient is rotated. Also, look at the dimension of the ramus from the right side and the left side, and that also tells us that the patient is rotated. So what are these two radiopacities? Are these implants? So implants are inside the jawbone, so it should have been recorded as sharp as the anterior teeth. And this object is sticking out of the mandible. So with the fuzzy border and sticking out of the mandible, we know that this structure is not inside the bone. So these are metal buttons on a winter jacket. So look for anything that can come out, and this may include a winter jacket or a clothing with zipper or a hoodie with some kind of metal component. So this should have been taken out. See, the chin is tipping down, right? So this prominent smile, and the hard palate is pointing downwards, so there's chin down error. And of course, I'm sure you are never going to make a mistake with the eyeglasses. With that, thank you for listening, and please come back again for another lecture. Bye-bye.